Recently, President Donald Trump has been diagnosed of chronic venous insufficiency. But what is this? Several of my patients and friends are asking me. The circulation in the legs has two main components, the arteries and the veins. The arteries are the tubing system that brings the blood from the heart to the feet, and the veins will bring the blood back from the feet to the heart. When the arteries has a problem, usually we call it PAD, or peripheral artery disease, and when the veins has a problem, we call it chronic venous insufficiency. There are several reasons why somebody has chronic venous insufficiency, but the most common is called venous insufficiency due to saphenous veins. These saphenous veins are basically the second most important veins bringing the blood from the feet to the heart, and they have small valves inside of them, and when these veins get dilated, these valves don't close as it should, and the blood, instead to return 100% to the heart, some of this blood get pulled and stay in the ankle area. That is why most of the patients, they feel this fullness, heaviness, tiredness in the legs that usually produce discomfort. Not only discomfort, it can produce pain, and most of the patients tell me, "Doctor, I don't know how to explain my symptoms, but something is wrong with my legs. But when I elevate my legs in a recliner, oh, it feels so good." It's very common if you need to sit down and elevate your legs in a recliner, or lying in bed and elevate your legs in a couple of pillows, it's very likely that you're suffering from venous insufficiency. But the good news is that this can be diagnosed and also can be treated in an office of a vein specialist. The most important test to do this is to do an ultrasound of your veins in your legs. Ideally, should be in a standing up position, or at least in an angle. The bed shouldn't be flat, should be in an angle to provide this blood to return and to evaluate well the circulation of these veins. The procedure is relatively easy. Ideally, it needs to be done by an ultrasound technician with experience on it. Like you probably know, there is no needles involved, no radiation. It's just the gel that we use in the ultrasound. This condition is relatively frequent, especially in somebody older than 65, but also could affect younger populations, especially females after a pregnancy. Several of these young girls will notice significant worsening of varicose veins, and also the symptoms related to that. Also, some professions that has a prolonged standing, such as hairstylists, cashiers, teachers, nurses, has more propensity to suffer from this condition as well. But always there is a hereditary factor. If the mother or the father had this condition, most likely the son or the daughter will suffer. And most of the patients initially don't notice any changes in the ankles or in the skin, but with time they are going to notice some swelling, especially in the afternoon or evening. And with time, you're going to notice the skin gets significantly darker, especially above the ankle. With time, we'll get thickening of the skin, then thinning, and very likely that could develop in an ulcer in the future. The treatment usually involves two components. One is conservative management, and the second is treatment or procedures related. In the conservative management, compressive stockings are very important, very fundamental in the treatment of this condition. Most of the patients, they feel significant improvement, the fullness, the heaviness, the swelling markedly improve, but some of the patients don't tolerate it well because this hot weather and to put compressive stockings is not easy here in South Texas. Other recommendations are keep physically active as tolerated, try to lose some weight, elevate the legs on a recliner or on a couple of pillows. All of these recommendations will help. If the conservative management is not enough, is when we decide to do a procedure called ablation. In the past, we, as surgeons, used to do what is called a vein stripping, but this is rarely used at this time. The vein ablation has two main options. One is with catheter base, or the second one is with a foam sclerotherapy or a glue sclerotherapy. All of these procedures are relatively short. It takes 30 minutes, maximum 60 minutes to be done. And most of these patients feel significant relief of the symptoms with this therapy.